jadi perbincangan dunia. 113 negara sudah terjangkit.
Incentives. These two needs proper oversight measures exercised by the House to ensure that the people in poverty and in needs receive a benefit the most. The depth of the crisis, budget deficit, including Indonesia, the current deficit target is expected by 5.07% of GDP. However, law on the state financial mandates a deficit cap no more than 3%. A government regulation in lieu of the law has been issued by the government allowing for a raise of budget deficit more than 3%. Despite rapid action needed by the government to urgently provide fiscal stimulus to the most needed one, there should be a stringent guidance measures to ensure that it will not fall to the wrong side. We are now in a deep deliberation within the Parliament to scrutinize the flexibility laid down by the Perpu, including the impunity clause provided by the regulation. One thing needs to be certain: there shall be no one above the law, even during the time of crisis. We cannot let emergency power becomes a medium of profiteering. The great lockdown, partial and even semi-quarantine measures have made recession imminent. The global economy projected by the IMF is to contract sharply by -3% by 2020, much worse than the 2008-2009 financial crisis. The IMF has received more than 85 countries appealing for emergency financing. And what is more interesting is that some of the countries even issued or held a debate to issue a pandemic recovery or corona bond with their national financing. Indonesia is in a discussion for such recovery bond. However, we have already released a global bond with the longest tenor for around 50 years, a decision which will have consequences for years to come. I strongly argue to not leave the government alone in debt management. We need to question every single details of their actions, especially those related to financial consequences and public debt. Parliament all over the world need to expand their details to not just questioning health-related crises, but also debt management aspects. We appreciate the G20 policy to put on hold poorer countries' obligations and urge for more financial assistance to help the poorer countries contain the virus and mitigate its economic impact. Aside from our domestic constitutional role, Parliament can play important role at the international levels, including by backing up the decision of G20 members so that financial justice will serve the cause of global solidarity. The debt relief policy made by the G20 members to the poorer was a remarkable response to a joint call on debt relief for the poorest countries issued by the IMF and the World Bank in March 2020. This joint call has signified the role of multilateralism in establishing the world order. A global coordinated action is much more needed to counter the crisis. We need a supported and coordinated assistance, both in terms of health assistance, global public health policy development, and financial relief. The pandemic may change the global landscape, but multilateralism should remain at the core of cooperation. It is not the time for a blame game to other global stakeholders, including the international organization, who provides us with a global platform of cooperation and coordination. The Indonesian House deeply concerned on the fact that the US current administration has cut financing to several international organizations, including the most recent WHO. As the promoter of the UN resolution of global solidarity to fight COVID-19, Indonesia reaffirms its support to the WHO, especially during the time of pandemic. The WHO remains pivotal in providing education, scientific information, and guidelines to contain and mitigate COVID-19, and Parliament should be at the forefront to provide such support. Another part where parliamentary role at the international stage becoming significant is by strengthening bilateral contacts and communications. Parliament can hold regular contacts and communication on several bilateral issues, including on the protection of international migrant communities. It is important to ensure that migrants are not overlooked by the national response. Migrants have an equal effect of contracting COVID-19 as well. They should receive an equal and proper healthcare facilities and testing response. And further, due to the economic shutdown, we need to pay attention to their livelihood situation. In this context, I would like to appeal to our parliamentary panelists here not to neglect the Indonesian migrant workers who are currently residing in your country and vice versa. This is a humanitarian appeal for us to look and care each other wherever and whenever needed. Another example of how Parliament can play its part to address the pandemic is by acting as the information gateway from the international scientific community and organizations to the citizens. The outbreak has led to the occurrence of numerous fake news and disinformation, hampering efforts to mitigate the pandemic. With its outreach power, parliamentarians can encourage citizens to be more aware of the danger of disinformation and well informed about health-related information. A regular communication or discussion with international organizations like the WHO in busting any health myths, fake news, misinformation, and disinformation is crucial for not just public health, but also democracy. Parliamentarians need to be the agent of information, a fact checker to uncover the darker side of political and commercial manipulation of the pandemic. We should not get involved in the reproduction of such fake news, hoaxes, misinformation, and disinformation. It is urgently needed as well that Parliament has a myth-buster center in cooperation with the trusted fact-checker institutions or international organizations. The growing international role of Parliament requires a more adaptive interparliamentary organizations to serve its purpose. I appreciate the Interparliamentary Union, IPU, who has provided a compilation on how Parliament coping with the pandemic situation today. More innovations from other interparliamentary organizations, including the ASEAN Interparliamentary Assembly, AIPA, are expected to serve the interests of its members during crisis. I would like to suggest to Vietnam, as the current president of AIPA, to urge the Secretariat of AIPA in finding innovative ways and functions to not just serving as a platform of regular contact and communication, but also as a Southeast Asia information pool on the COVID-19 and its related impacts. So I would like also to suggest the WHO Indonesia office to have a regular contact communication with the Committee for Interparliamentary Cooperation as a means to develop a Mythbuster Center in the Parliament, including to update us with the new development on the COVID-19 itself, including the development of the vaccine. We are now at the peace with the situation as a new normal, but the question remains, when this pandemic is over. Thank you. Wassalamualaikum warahmatullahi wabarakatuh. Thank you, Charles.
Thank you for the insightful sharing, Dr. Falizon. Before we move to the next presentation, I would like to welcome the participants who just joined our webinar. I apologize that we had some technical problems in the beginning, limiting the number of participants to only 100, but I think now it is open to 500 participants. Okay, for the next presentation, I would like to invite Honorable Dr. Navaratnasamy Paranitaran. Dr. Parani has been the WHO representative to Indonesia since 2018, January. He started his career in the private sector and NGOs in Asia and joined WHO in South Sudan and Somalia offices from 2005 to 2009. Dr. Parani is a medical doctor from the University of Colombo, Sri Lanka, and he has a Master of Public Health degree specializing in health policy and financing, and also postgrad studies in healthcare leadership and management from Johns Hopkins University. With the extensive experiences and background of Dr. Parani, we look forward to hearing his thoughts about the pandemic, especially on the global health leadership that is critical nowadays. A week ago, we heard a warning message from the WHO Regional Office of Southeast Asia, emphasizing that COVID-19 epicenter may change, and it could be in Southeast Asia if no further restrictive measures to curb the pandemic. We would be very glad if you could share your thoughts and experiences on how to address such complex situation around the pandemic. Please, Dr. Parani, the floor is yours.
Thank you very much, Mr. Moderator. A very good morning to everyone. The Chair for the Committee for Interparliamentary Cooperation of Indonesian House of Representatives, Dr. Fadli Zon, the Vice Chair and our Moderator, Honorable Charles Honoris, the members of Indonesian House of Representatives, all the members of parliaments and representatives of various houses in the different member states, other invited guests, ladies and gentlemen. Once again, a very good morning to you. Thank you very much for the invitation from the organizers. It's really nice to be here with the parliamentarians. And before even I start my presentation, I commit our continuous working as requested by the Chair, that we will work with you on Mythbuster and more on this crisis. Now, I put a few slides. It's just a bit of an introduction, that's all. While today is 21st April, any information presented is valid as 19 April. That's how fast this virus and the situation is. Globally, we have seen more than 2.3 million, and which may very soon be 3 million in a week's time, and more than 100 10 countries with the highest number of cumulative cases are put on the slides. Particularly USA have 723,000 and is growing. And then Spain, Italy, Germany, UK, France, and then of course China, Iran, Turkey, and Russia. As you see, the outbreak has moved from Southeast Asia to Europe and USA. However, as the previous speaker mentioned, and as our moderator mentioned, that we are concerned about Southeast Asia still. There is a high chance that this may return in a different country, possibly, not exactly in China or South Korea or others. So that's a worry, but this is a current pattern. Now, we do have sit reps and others. You're probably well aware of that, so I don't want to talk much about that. There's a lot of information out there. I've tried to keep this presentation very brief, just to give a prelude, and then happy to respond into the panel discussion or the questions. Now, the areas for global cooperation. I know my previous speaker, the Chair, also mentioned about economy and all of the others. But from our point of view on the health side, what we look at more is that the real-time sharing of best practices and research findings is going to be extremely critical in this pandemic response. Simply because we know a lot about this virus. We know a lot more about this virus today than what we knew in January or February, but we still have a lot of gaps in the information and the knowledge about this virus. And also best practices of how to control the pandemic. I'm happy to see South Korea here. And South Korea has provided a great example of how to manage this pandemic by controlling a lot of testing and a lot of other strategies. At the same time, still keep South Korea open a bit rather than totally locked down. So things like that, we need to have more sharing, and we need more international cooperation on that. The global supply chain for equipment, supplies, and test kits is extremely critical. One of the challenge and one of the reasons, like we announced a public health emergency of international concern on January 30th, but the talk about pandemic came only in March, is that when countries close borders, that create a bit of a challenge. I'm sure each one of you from your country or even here in Indonesia, we felt a challenge of getting the equipment, supplies, and test kits in country on time. And I think that's something that international cooperation and the trade should not be restricted for economic reason, but also for this kind of a health reason. Then the diagnostic test kits and reference laboratories is an important part. We have 15 global reference laboratories. And I remember at the beginning of the outbreak, we brought laboratory test kits from one of the reference laboratories in Germany here. And similar way to a number of countries. Today, WHO is shipping millions of diagnostic test kits to more than 100 plus countries all over the world, because testing is the key for this virus. Only if you test, then you can isolate and treat the people and contact tracing and make sure they are quarantined. And that's the only way to actually suppress the virus. Otherwise, the physical distancing measures are going to buy some time by flattening the curve a bit, but that is not going to exclusively help us actually defeat the virus. So the diagnostic test kits and reference laboratories is an international part, important international cooperation. The other one is a global solidarity trial that WHO has launched. More than 100 countries are participating. We have 4 different treatment regimens that are being tested on this, because as you know, until as of today, we do not have a clear treatment regimen for this virus. And that's something we are doing globally. And that's a great cooperation. And there are other trials also ongoing on a number of other products and treatments as well. So that's another great area for international cooperation. The vaccines in development at various stages, 3 have moved to human trials, and another almost 60 plus are in different stages. And while we are not expecting a vaccine to be ready in the next few months, it's important to have a vaccine available, because that's the best way to be able to prevent. And then, of course, support resource poor countries, not just by debt relief, but also actually by giving them more supplies and expertise and technical support, as well as financial resources. And then equitable allocation of the test kits, or when we have a treatment regimen or vaccines all over the world. I think these are very important areas for global cooperation. This is not a comprehensive or exhaustive list, but I just thought I'll put a few for discussion or consideration. Thank you very much once again for the organizers and all of the participants. I put the laboratory picture here because I think laboratory is going to be the game changer in this response. And let me conclude this presentation by recognizing and appreciating the organizers for organizing this great event, and recognizing all the health workers who are on the front line, who are the real the army, or who are fighting this battle for us. Thank you. Terima kasih.
Thank you very much, Dr. Parani. Very interesting, a very hopeful insights, and I believe the key of your message is that global cooperation is necessary for us, for all of us, to be able to prevail against this war against COVID-19. Now, the third presentation, I would like to kindly invite Excellency Dato' Haji Muhammad Rashid bin Hasnon, the Deputy Speaker of the House of Representatives of the Parliament of Malaysia. He is now also a Member of Parliament for the constituency of Batu Pahat in the state of Johor. Dato' Haji Muhammad Rashid obtained his Master in Business Administration from University Kebangsaan Malaysia. Dato' Muhammad Rashid has an extensive humanitarian mission experience, such as when he joined the team of volunteers to Aceh and Mulabo to help victims of tsunami in 2004, and the relief mission in Gaza in 2011. Welcome, Dato', and thank you for joining us today. We would like to hear how Malaysia deals with the COVID-19 pandemic, especially how the Parliament performed their legislative oversight and budgetary duties in response to the COVID-19 situation in Malaysia. Please, Dato' Haji Muhammad Rashid, the floor is yours.
Thank you, Mr. Moderator, Mr. Charles Honorist, honorable members of the webinar, Mr. Fadlizon, the Chairperson Committee for Interparliamentary Cooperation Indonesia, Dr. Navarat Sami Parani, Indonesian representatives, Honorable Mr. Nguyen Van Giao, the Chairman Committee for Foreign Affairs, National Assembly of Vietnam, Mr. Kim Jin Poo, Chairman of the Coronavirus Special Committee, National Assembly of Korea, and the rest of our panel members, including, I would understand, Mr. Moderator, not 100, but 500 people might be hearing this webinar. First and foremost, congratulations the organizer for being able to make connection, especially from the Southeast Asian countries. But things can be better off if some other members of the country, as I have Alicia from, like Singapore, maybe Philippines, and our member country. Probably this will be the beginning. We can still do more in the near future while the pandemic coronavirus is still around. On my part, I will be communicating about 3 topics: the updates from the Malaysian scenario on how we are in togetherness tackling this the coronavirus in Malaysia. The second part is the diplomacy among the member countries, and of course the third one I will be highlighting about how the Malaysian Parliament is handling this together as a team in our country. So ladies and gentlemen, as of 19th of April 2020, to date, or rather the latest is 20th of April, yesterday, Malaysia has a total of 84 confirmed COVID-19 cases, whereby this is among the 3 consecutive days the lowest, below 100, after about 3 phases of our lockdown. We have, as announced by our Prime Minister, by the way, our Prime Minister is a new Prime Minister. In the midst of this coronavirus, there was a change of the executive committee in our country. It's our new Prime Minister, Tan Sri Muhyiddin Yassin. Has been, once he was on board, he has been leading all the way with the rest of the executive in handling coronavirus. As of today, Malaysia, has been there in handling this. We have a total test of 100 and what's the figure? 113,055 cases. Out of that, we have confirmed 5,425, which is about 4.7%, and the discharge rate has been the highest so far at 60.7%, which is 3,295. That's quite high, and there are currently 2,041 active. With the current phase now is only 45 confirmed. They are in the intensive care units, and as low as about 28 in the ICU. For now, our lockdown still be continuing for the third phase until the 28th of April. And surprisingly, yesterday, 0 death. There is no death, and I hope, but we are saying that we are not going to rest in our laurel. We have about few scenario. Now, to stop it, the movement control order, not yet, because the sooner we stop, maybe they will still come back. As Dr. Parani says that there is no cure for the time being, so it is better prepare ourselves as far as the Malaysian scenario is concerned. We are focusing ourselves ready for another few more months, 4, 5, 6 months down the road. So the National Movement Control Order has been strictly followed. In fact, we are using our Majlis Keselamatan Negara is the highest authority assigned by the Prime Minister, MKN, with collaboration with the Ministry of Health as well as the police and also the soldier. They are making sure people are following very strict, and with the help of very rapid and robust the communication in our national television, in the 1 meter distancing. Like me and Mr. Moderator, we are 1,000 miles away, right? We are for sure we are maintaining our distancing and cleaning our hand. That's always been air up in our local media, the television Malaysia, and the other ministries like Ministry of Education, Ministry of Entrepreneurial, this ministry, they all in a team to make sure that especially the businessmen, they are very much eager to come back. We say not yet. They have to follow strictly the movement control order by the government. And every day, the Director General of Ministry of Health, Datuk Nur Hisham, recently has been appreciated his work as a leader in the Malaysian medical community, one of the best managed in pandemic. But he said that it's not his job alone, it is the collaboration between all the ministries that we have. For now, the issue is how do we manage between the lockdown as well as the economy. We have our Ministry of International Trade and Industry, which is Datuk Suri Azmin, has been together in making the decision. The business need to go on. If it's total lockdown, if the business did not come back, then that will affect the GDP of our country. So bit by bit, the cabinet has approved only certain industry with a very strict control of the standard operating procedure in their respective industry. We are also, as mentioned by Honorable Dr. Fazli Zon, we are also aware on the people of Malaysia are the upcoming Ramadan. In fact, this coming Friday and also Hari Raya, if we were to open that, again, there's a mass gathering. For now, we are say the Ministry of the religion, Menteri Agama says that for now, we have to strict follow the MCO. They call it do the perform prayer in the house, and also maybe Hari Raya also in the house. No, big gathering. The second mention is about the diplomacy between the among our leaders. There has been ministers with the collaboration, the bilateral video conferencing meeting with the Minister of Health, Malaysia and Singapore, for example, and also our Prime Minister too has got teleconferences with the various parts of the world. Wanted to find the best solution. And on the part of the Parliament House, we are supposed to have our first opening sitting in March, but has been deferred next month, which is in May 18th. We have had the message that we have already told all the Member of Parliament to have an opening, 1 day opening. The question whether we can do that like what we do now, Member of Parliament doing it using a video conference, Unfortunately, we did not have that in our standing order. For now, all the member of parliament, we have 220 of them, is been invited to come for the opening, but no visitors. And we are actually looking into some other practices in other parts of the world, where when we are practicing minimum 1 meter distancing, that means we leave one chair, empty from one member of parliament into the other parliament. The purpose for us to have this is mandatory for us to have once opening every 6 months. So the last date is early June. So we have to do it in the month of May, in the midst of before we celebrate Hari Raya. Yeah, 5 days to go for Hari Raya. So the purpose is we have to approve some of the additional budgets that has been announced and they've been going to be used by coronavirus. We the Malaysian government, Prime Minister has announced about 250 million billion of our budget, and that has got to be approved by the in the parliamentary session, both the Dewan Rakyat and also after that will be the Senate, the House of Senate or Dewan Negara. So, ladies and gentlemen, in conclusion, Malaysia has been doing our level best. In fact, we have had announced one of the application to track this coronavirus. They call it My Sejahtera. We are also learning on how Korea did it by using an application. We can trace it up, and there are clusters that we have managed to identify. For example, the religious Muslim gathering, Tabligh gathering, and then the Christian gathering. And not only that, those Malaysians who just came back from many other countries, from Italy, from Europe, from Indonesia. We are managing them, and for now, there are about 9 areas that has been locked down, which has got a very strict, they call it PKPD, which is a very strict area in various spot in Malaysia. So with that effort, we hope that with the help of WHO, we can find the solution for this, and hopefully together we can defeat this coronavirus in all totality. Thank you so much. Okay, have a nice day.
Thank you so much, Mr. Deputy Speaker. A very remarkable insight. I do hope that even when you have to have a physical seating in Parliament, all members of Parliament in Malaysia will be healthy and stay safe from the COVID-19. And next, I would like to invite Honorable Mr. Nguyen Van Giao, the Chairman of the Foreign Affairs Committee of Vietnam National Assembly. He is member of the Central Committee of the Communist Party of Vietnam and also member of the Standing Committee of the National Assembly, and also the Chairman of the Foreign Affairs Committee of the Vietnam National Assembly. After Mr. Giao, we will shortly hear talks delivered by Honorable Dr. Lan Hue Nguyen, member of the Vietnam National Assembly and Associate Professor and Director of Hanoi Medical University Hospital. As a doctor, he is also a director of the Cardiovascular Center at the Hanoi Medical University, and also was the vice head of the catheterization lab of Vietnam Heart Institute. With the extensive experience of Dr. Hue, who would have been publishing various books, research, and articles on cardiovascular and cardiology, and also as a parliamentarian, we would be very glad to hear his sharing on how Vietnam tackles COVID-19 pandemic from both the medical and the parliamentary perspectives. Please, Mr. Giao and Mr. Hue, the floor is yours.
Okay. Thank you, Mr. Moderator. Dr. Feditron, Chairman of
Dr. Fadlison, Ketua Badan Kerjasama Antar Parlemen Republik Indonesia, rekan-rekan dari Indonesia, Malaysia, Singapura, perwakilan dari WHO. Selamat pagi Bapak Ibu sekalian. Nama saya Nguyen Van Giew, salah seorang wakil ketua dari Majelis Nasional Vietnam. Pertama-tama, saya ingin berterima kasih kepada Dr. Fadlison dan DPR RI yang telah menyelenggarakan telekonferensi ini mengenai COVID-19.
I fully share with you that the COVID-19 is heavily affecting in the region and all the world. We, with our responsibilities as people's representative, need to work together, share experiences and coping with the COVID-19 and overcome difficulties caused by the severe pandemic. In regard, I wish to emphasize the message of my President of the National Assembly, the Chairwoman IPA 2020. In her letter to IPA member Parliament dated on March 30th, 2020, calling for more action from the ASEAN and IPA member Parliament to join the government's efforts responding to the pandemic by promoting our role, adopting the measures and policy for the disease. We also follow up closely with the recent ASEAN and ASEAN Plus 3, the Basel Summit on COVID-19, chaired by the Vietnamese Prime Minister Nguyễn Xuân Phúc. Vietnam chaired ASEAN 2020 in Hanoi on April 14, 1 week ago. The summit declaration, the determination and commitment of ASEAN members. The problem. Okay, go on. The summit declaration reiterates determination and the commitment of the ASEAN member states in the pursuit of the cohesive and responsive ASEAN to remain united and to jointly and decidedly to control the rest of the disease while mitigating and adverse impacts on our people, livelihood, our society, and economies. Joining the meeting today with me, I'd like to introduce my colleagues, Mr. Vũ Hải Hà, the Vice Chairman of the Foreign Affairs Committee, and important person, Professor, Doctor of Science, Medicine, Dr. Nguyễn Lân Hiếu, and some professor and doctor from the Hanoi Medical University. Professor Dr. Nguyễn Lân Hiếu will be please share with you some information and experiences of the Vietnam in the fight again COVID-19. Now, the floor for Dr. Hill. I wish the meeting platform and file success. Thank you.
Thank you, Dr. Nguyen. Please, I give you the floor, Dr. Lan Yu.
Thank you. Good morning. Please turn off. Good morning. I'm sorry I'm using mask because we are staying in the same room with Mr. Zhou and Mr. Ha. And thank you to invite us to come here to share our experience to fighting against COVID-19. As you know, Vietnam began preparing a strategy to combat the outbreak immediately after the first case in China. In early February, Vietnam kicked off the series to fight against the spread of COVID-19. For example, we fly come from China and go to China early February in 2020. Also, we decided to keep the school closed after Lunar New Year until now. Complex the approach of the early and community epidemiological intervention, tracing, mass quarantine, social distancing, decide to leadership and social unity. Vietnam quarantine policy and carry out complete tracing of all people who come contact with the virus. The measures were implemented much early against the epidemic in China. We looked out in district city were used to keep the virus from spreading further. As a nationwide social distancing rule, this is like a banning outside gathering of more than 2 people, keeping distance more than 6.5 feet, like 2 meters, and the temporary shutdown of non-essential business, including restaurant, entertainment center, and tourist seat. The supermarket and other service remain open, but we are keep the safeguard to checking the temperature before entering the building and ask our people hand sanitizer. In March 2020, all Vietnam and foreign nationals are required to use a face mask like us now in public place and such as airport, bus station, supermarket, and public transport vehicle in Vietnam. All passenger and domestic international flight to and from Vietnam have to use mask during the flight and during they stay in the airport station. So far, now you know, Vietnam, we have 75% of 268 confirmed case recover. And up to now, we have a 5-day, no more new case infection. And during the infected cases, we have some severe disease, but we don't have any death. At the same time, the country continue to perform a mass surveillance, quarantine potential endemic area, and mobilizing medical staff, hospital, military force, and police, the civil defense, direct combat, and all levels of the strengthening of local capacity to respond of this disease. Up to now, many provinces and cities in Vietnam have no COVID case, but we still keep the measurement, include the distance, disinfecting public place, raising the people aware about the disease prevention. Some of the provinces still apply to social distancing until tomorrow, and we still waiting for the next decision from our government to continue of the distancing or not. Vietnam also launched telemedicine user alternative during the corona pandemic in last week. In the first hospital using this is our hospital, Hanoi Medical University Hospital. The Minister of the Information and Communication and our MOS joint launch medical examination and treatment platform distance from our hospital to another province hospital and to direct to the people stay in their house. And using the Blue Zone application during coronavirus pandemic. The telemedicine is serving useful to alternative to meeting with the doctor. And the telemedicine development by Viettel company is made in by Vietnam and includes the health consultation, diagnostic and treatment, the professional evaluation and operation consultation, and technologies transfer distance. The telemedicine will help to reduce the number of the patient coming to the hospital, and the patient can stay at home, and it can help the facility, the staff of both the large and small facilities justify themselves overwhelmed with the patient overload. And another one is very important for the patient data. Using the telemedicine, we have a patient data, and the patient can easily to follow up and after treatment and after surgery intervention. Ladies and gentlemen, with me in our room, we have two specialists, because you know I am not I'm cardiologist. I'm not a specialist to fight against COVID, but we have a Professor Lê Thị Hương. He's the director of CDC in our hospital, our university, and our chief department of infection department is Dr. Nguyễn Quốc Đạt next to me, and we are open to answer all of your questions. Thank you very much for your attention.
Thank you very much, our distinguished guests from Vietnam. I think we would have a lot of things to ask you in our question and answer session, seeing that Vietnam has a remarkably low infection rate and no deaths until as of today. Next, we will have the Honorable Mr. Febrian Alfianto Rudiard. He is the Director General for Multilateral Cooperation at the Indonesian Ministry of Foreign Affairs. He previously served as the Deputy Chief of Mission of the Embassy of the Republic of Indonesia in Austria. Last March, the first multilateral coordination over the COVID-19 pandemic took place when leaders of the G20 countries pledged to inject over $5 trillion into the global economy to limit job and income losses from the COVID-19 in a virtual summit hosted by Saudi Arabia, where Indonesia was also a part of. While on April the 3rd, the UN General Assembly has adopted an Indonesian-sponsored resolution entitled Global Solidarity to Fight COVID-19, stressing the need for a stronger international cooperation to address the pandemic. And we would be very happy to hear your thoughts on the importance of multilateral cooperation in addressing both the pandemic and socio-economic effects of the COVID-19 crisis at the global level. I was told just now that Mr. Febrian will be conducting his presentation in Bahasa Indonesia. So please, if you would like to hear a translation in English, there are the options to do so. Thank you. Please, I give you the floor, Mr. Febrian.
Thank you so much, Pak Charles. Thank you so much. I think I will prefer to deliver my presentation in English, since it will not make any difficult for other colleagues who have to do the translation. First of all, I would like to yang terhormat Bapak Dr. Fadlizon, Chairman of the Committee for the Interparliamentary Cooperation, and the other speakers. But I am very glad that, not only glad, but I also appreciate and feel proud that the Indonesian parliamentarian has decided to hold this webinar. And of course, this is very important for us, and it's reflecting the importance of this issue, not only for the responsibility of the government, but also by the parliamentarian. And for sure, we need to be more united now and in facing this challenging time. And of course, we have to acting as one. As we have been heard the presentation made by Dr. Fadlizon, a very brief and comprehensive presentation. I think I would only like to make some add-on information, additional information, specifically on the issue of international cooperation, how we deal with this pandemic. as this was the core business of the Ministry of Foreign Affairs. Mr. Moderator, I think in this auspicious occasion, we have to acknowledge that the challenge that we face now is unprecedented. Unprecedented